Will an ultrasound show blocked fallopian tubes during a fertility assessment? This is a common question for those exploring fertility issues. While ultrasound is a widely used imaging tool, it has limitations when it comes to detecting blocked fallopian tubes. A standard transvaginal ultrasound typically cannot show whether the fallopian tubes are blocked. This is because the tubes are narrow and not easily visualized unless they are abnormally enlarged or filled with fluid. To accurately assess whether the fallopian tubes are open or blocked, specialized tests are usually needed. One primary test is called hysterosalpingography. In this procedure, a contrast dye is injected through the cervix into the uterus and fallopian tubes. An X-ray is then taken to visualize the dye's passage, which helps identify any blockages or abnormalities. Another option is sonohysterography, also known as saline infusion sonography. This ultrasound-based test involves injecting saline into the uterus to better visualize the uterine cavity and sometimes the fallopian tubes. When combined with a contrast agent, it can provide information about tubal patency, but it is less commonly used than hysterosalpingography. Laparoscopy with chromopertubation is another method. This is a minimally invasive surgical procedure where a camera is inserted into the abdomen and dye is passed through the fallopian tubes to check for blockages. This method is considered the gold standard for diagnosing tubal issues but is more invasive and usually reserved for cases where other tests are inconclusive or when surgery is also planned. It's also important to consider conditions like endometriosis, which can cause scarring and adhesions that block or damage fallopian tubes. Since ultrasound cannot reliably detect these blockages, relying solely on ultrasound may miss critical information for women with endometriosis or other conditions affecting tubal function. In summary, a standard ultrasound alone will generally not show blocked fallopian tubes during a fertility assessment. More specialized tests, like hysterosalpingography or laparoscopy, are needed to accurately diagnose tubal blockages. For individuals with endometriosis or suspected tubal disease, these diagnostic procedures are vital for guiding appropriate fertility treatment options. Always consult with a healthcare professional for personalized advice and recommendations.